Hello, class, and welcome to the question and answer session for NUR 322, Patients with Complex Care Health Alterations. My name is Professor Diane Morrison, and I am sharing this class with Dr. Perez, as we are both teaching NUR 322. This is basically a question and answer session, and as of right now, I do not see that there are any other participants. So I will move on to an overview of the first assignment and a few other added suggestions that hopefully will be helpful to you to be successful in this class. One of the first things I'd like to remind you is to make sure you're reading your announcements on a regular basis. I use my announcements to not just add welcome to the week, but other information that I hope will help you to be successful and is also informative information. The other thing I'd like to talk about is the discussions, and we are in week 2 of the discussion. These discussions may differ a little bit than previous discussions that you've had in other classes. In this class, you will find that many times there's more than one question, and you will be divided into half the class. So please make sure that you look to see where your last name falls and answer that question appropriately. And then try to answer one of the posts from your classmates that answered a different discussion question. The other thing I wanted to point out is that make sure you are reading every part of the discussion question. The second question this week talks about where you would like to work when you graduate, but you're going to use the nursing process as your framework to decide how you're going to make that decision. So make sure you are answering all parts of the discussion question. This past week, we did ask you to use the ACEs framework in discussion 1. So if you did not use that in your discussion question, you may not have received all your points. So it is written right here what you would do to answer the questions, to answer that question. So always make sure you read every piece of the discussion question and answer every one of the questions that are being asked. It's usually not just one question. You do have quizzes in this class, so you will have a quiz every week. The purpose of that is to keep you ready to take NCLEX style questions. So make sure that you are using these quizzes to your advantage, because it's a way to test your knowledge about the subject matter, and most of the subject matter in this class is med-surg related. You have 2 assignments. The first assignment is due week 3, and that is the assignment I am going to talk to you about today. This assignment is worth 125 points, and it is assessment of a community. It can be a community where you live or a community where you might want to live or have visited, but it is a community, and what you are assessing is what types of options are available for complex care or critical illness. Don't get this confused with the one you did in NUR 312, where you assessed healthy populations. It is different than that. So make sure that you are looking at all the criteria and answering all those questions. So in the first criteria, it's your introduction, and what you're going to do is look at a community that you want to assess. And again, I said it could be where you live, where you might want to live, where your parents live, but it needs to be a community. I will use the community. I live in a suburb of Milwaukee, Wisconsin, but I'm going to use a community where I previously lived, and that was Kenosha, Wisconsin, which is about 50 miles from Milwaukee, Wisconsin. So I'll use that as a reference. So I would talk about that community, and my first part of this paper is I'm going to talk about demographics. And what demographics are, examples are age, race, ethnicity, gender, etc. So you're looking at your community, talking about the population and general demographics. You can talk about other things, where it's located, you know, if you want to include that it's close to mountains or anything like that. Any information that describes the community where you are going to be discussing, or what you're going to be discussing. The next criteria looks at what complex care units are available in that community. So possibly you are very familiar with the community. You may know this, you might need to use, I don't think we use telephone directories anymore, but there is the internet, Better Business, any kind of information you might need to collect what kind of complex care areas are available in that area. So if I was assessing Kenosha, Wisconsin, they have 2 hospitals for that area, and each hospital has an ICU, but neither hospital has an NICU, a CCU, a PICU, or a burn unit. So basically, they can handle complex care patients, but any higher level patient would need to go to Milwaukee, Wisconsin. So you're looking at your own community, what is available, and also include, you can include any type of, many areas now have what they call emergency rooms. So they're small emergency rooms that are not connected to any hospital, but you could go there and then you would be triaged to a larger facility. So look at that in the community where you are assessing. Then in the community that you are assessing, what is the level of technology? It could be very basic if you live in a rural area, or it could be very complex. Is it current, advanced, or outdated? An example I can give you is in Kenosha, Wisconsin, because it's smaller and it's about 50 miles away from a larger city. They have in one of their ICUs, in one of the hospitals, a teledoctor that they can call from every room in the hospital and connect immediately to a physician in one of the larger hospitals. So that would be an example of advanced technology. So then you're going to describe in the area criterion 4, what's not available. What don't you have in your community? How far is it? How long would it take you to get there? How do you get there? Would it have to be a helicopter, ambulance? How would you get to those hospitals? So if I needed higher level care from Kenosha, Wisconsin, I would have to go to Milwaukee, where I would find a CCU, ICU, a NICU, a PICU, a burn unit, a stroke center, and various other critical care units. And please explain where they are located, because sometimes towns, cities have 2 large hospitals and they don't always have, not everyone would have a burn unit, but someone else might have a stroke center. So please be very specific in what is available elsewhere. Number 5 criteria, what barriers are present to people that live in the community you are assessing? So some examples could be transportation. How do we get from the city to, or the local town to a city that has more complex care? Could be financial, could be language. Think about what would prevent people from getting the highest level of complex care. Number 6, describe how the public could be made aware of the available resources, or you could also tell us how the public is aware of the available resources. And I think nowadays you see billboards, internet advertising on TV. So think about those types of ways the public is made aware. Finally, the last criterion is your summary. And you're going to summarize your paper, and then, very important, describe both the positive and negatives about your community, what's available, what you found was helpful, and what you found as a negative. This paper needs to be 3 to 5 pages in length, and it needs to have a minimum of 2 scholarly references. Now, scholarly references are references that the best way to find these are to go to your library and look up nursing journals that relate to complex care, community, and include those in your resources. You can also include information that you might have got from the internet or some type of directory about your community. Make sure that you're using APA format and use good grammar. And again, the 80-20 rule means that only 20% can be quotes. So that is how you write this paper. I always say when you're writing a paper, make sure that you're answering every question criteria limit that are listed in this area. So make sure you cover everything that's listed in here. That way you can be assured that you've got a very good chance of getting all the points related to that area. If you have any questions, please let us know. We will also include an example of a paper that has been written about this subject matter. Please make sure you do not use any parts of that paper, use it as a template or anything, because it will increase your Turnitin score. Again, let us know if you have any questions about this assignment. When your next assignment, your PowerPoint assignment does come up, there will be a video presentation on how to do that. So once again, welcome to this class. We hope you find it a good learning experience. We are here to take you to a next level. We want you to start thinking like a nurse. You will find that in our discussion questions, we are going to ask you questions to say, what would you do in this situation? You are now the nurse. How are you going to handle it? So you want to start being the nurse, thinking like a nurse, and that is one great way to increase your critical thinking skills. Again, if you have any questions, please let us know, and we will be seeing you in the threads.